Hey, what's up, everybody? It's Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center. It's been a while since I made a video, so I wanted to get right back into it. First, before we go into this case about a patient who had a front implant and isn't happy about the way it looks, wanted to encourage you guys follow us on Instagram and Facebook. Our channel is at North Texas Dental Surgery. Okay, so North Texas Dental Surgery. All right, so let me show you guys this case. This patient came in about 2 weeks ago, and she wasn't happy about the aesthetics with her front implant that she had done. Okay, so here's the story on this case. This patient told me that she had a root canal and a crown that had been done many years ago. I think she said about like 15 years ago, something like that. That was the best I can recall. This was, again, a consult from 2 weeks ago. And this is the tooth in question. She had replaced with an implant. And I just wanted to tell you guys, in cases like this, I don't want to sound, I don't want to piss anybody off, but I cannot stand bad root canals because they can do so much damage to the bone. And the problem is that in cases like this, when you have a root canal, you're removing the nerve. And when you remove the nerve, you remove the ability for patients to feel any changes that may be affecting that tooth. For example, an infection. And what ends up happening in cases like this is that you can have patients that, because they don't feel anything, they don't feel that anything's going on. And a lot of times, a lot of dentists won't even be able to detect anything, that anything's going on there with a typical X-ray that we take in that area, a PA that we take in that area. And we can only notice these changes typically with a cone beam CT scan, so the 3D scans. And so what happens in these cases is that unless we get a CBCT on these cases, it takes a really long time for these bad infections to be seen on a traditional X-ray. And so a patient can therefore then have a long-standing infection, and therefore that infection gets really bad and therefore can do a lot of damage to the area. And by the time that these patients are typically diagnosed and then they come in to get an implant, because there is so much damage to the surrounding bone, it becomes very difficult to place a predictable implant. Now, I talked about this issue in some of my videos, and I will link them above and also in the video information below in my Dental Implant 101 series. I highly, highly, highly recommend you guys watch those videos because it will give you a very good fundamental understanding of the logic of how we do your dental implants and what you even need to look out for, and maybe you'll learn some good information to help you ask some questions from your dentist before you go ahead with the dental implant procedure. But going back again into this case, this patient had this tooth, again, this was infected root canal. And so I've seen so many of these teeth over the years, and so I could basically envision what I would see in a 3D scan. Again, obviously, this patient had this implant done months ago, so I don't have access to those scans. But the best I can recall, basically, of what she was telling me was that she had this tooth extracted, and she had a bone graft done, and she had a gum graft done at that time. And so they waited the necessary period of time. I'm not exactly sure how long they waited. In this case, maybe 4 or 5 months. And what they then did is they went ahead and they placed the implant, and then they did another gum graft at that time. Let's start at the main issue right at first. So when I look at a case like this, what is, like, obviously the elephant in the room is that we have what we call a big black triangle, right? So the papilla is the gum that comes between the teeth, right? And so it's not just, when people are typically looking for aesthetics, they're typically looking for the shape of the teeth. They want to get veneers, they want to get crowns done, they want a beautiful smile. But what helps, the contouring of the teeth and also the bone and the gums between the teeth, what we call the papilla, is actually a big determinant of the aesthetics. And obviously, we never would think of that in most cases, but now when we're looking at this case, we're like, oh my God, what the heck? Why is the gum missing between this area? Well, it's because there's no bone that's been between this tooth, and also because there's obviously a lack of gum. Well, in order for us to have gum in the area, we need to have underlying bony support, right? So the bone underlying the gums. And so I tell people, for example, if you were to think of an old school tent, if we don't have a tent pole there and to support that fabric, then the fabric is going to follow wherever the tent pole is. And so in a case like this, if there's no bone between the teeth, then we're going to lose that papilla. And so let me show you basically the x-rays on this patient. So here when we take a look at this case, she has very healthy teeth. You could see that this implant looks great on this panoramic x-ray. They sunk it pretty good subcrustally when they did this immediate implant. Well, actually, they didn't do an immediate implant. Again, they staged this approach. They waited months after the bone graft. But we don't see a major amount of bone loss in this area. It's a little bit lower than the adjacent teeth, but it doesn't surprise me based off of what I heard about, again, the case history with the patient having a root canal, a lot of bone destruction in the area. And let's look at her CBCT. Okay, so when I'm looking at this 3D scan, what do we really see? The thing I'm most typically, I care about is how much bone do we have on the outer edge. Okay, so when we're looking at this x-ray, we're looking at this patient from the side view, right? So this is the patient's nose, this is the patient's upper lip, this is obviously the lower tooth, this is the patient's tongue, this is the roof of the mouth. And one thing that we're really looking for, again, if you watch my Dental Implant 101 series, again, highly recommend you watch that video up here in the upper right, but you want to make sure that you have an adequate thickness of bone out here. Okay, so about 2 millimeters of bone on this outer edge, because that's going to be one of the biggest predeterminers of this patient ever having issues in the future, potentially with bone loss and gum loss, or this patient ever experiencing periimplantitis. But when I look at a case like this, again, I talked about in the Dental Implant 101 series that some patients can actually have what we call a thin biotype versus thick biotype, meaning thin bone and gums. And so when I'm checking this patient's adjacent teeth, I see that she has a thin biotype because even on her adjacent healthy teeth, she hardly has any bone to the outer edge. And so, typically in other patients, we would see more bone on this outer edge. Actually, let me look for an example real quick. Okay, I finally found a patient that has a thicker biotype right here. That literally took me 10 minutes. So that you could see again from the profile, you could see that we have some thickness of this outer edge of bone. And that's really what we're looking for when we're placing dental implants on patients. Patients that have a thicker biotype, we have more forgiveness, more leeway when we're doing their dental implants. They, in essence, have a better predictability. I've been practicing for 12 years now. I also did 3 years of residency, and I'd be lying to you if whenever we're doing anterior dental implants, front teeth dental implants, especially on patients that have high smile lines, that if they weren't somewhat stressful, because they can always end up being a little bit unpredictable. And I don't want to pat periodontists on the back necessarily, or say that we're better than other people by any means. But by far, you're going to see that periodontists have the most training back in residency for at least 3 years going in and getting specific dental implant training, especially with front teeth, to make sure that the patients have the most predictable outcome. So let's take a look at this case. So the patient has very thin bone out here, minimal bone at all. Again, most likely caused by the fact that she has a very thin biotype. Even on her other teeth, she has very little bone. And so, and also coupled with the fact that this was a previous root canal tooth, which tends to destroy a lot of the bone in the area anyways, and was probably a contributor as to why she had what we call the interproximal bone loss right in the middle that we could see right here. So what the periodontist that she had been working with had been doing was that she was focusing more so on the health of this area. And that's why when they did the extraction and the gum graft at that time, the gums look nice and thick, that's great, but obviously the main issue right here is the fact that the patient has a big black triangle. And so the patient's biggest issue right now is obviously this black triangle. She was coming in, and I felt extremely bad for her because she was very emotional. She was very upset. When she smiles, she actually has a high smile line. Some people, when they smile, they actually don't smile very high, so you would never even see what's going on right here. My dad, for example, he has a very low smile line, so you would never see something like this. But unfortunately, on some people, when they hike their lip up more when they smile, you can see something like this. So the patient was being recommended to do another gum graft which you can't do a gum graft that's going to basically build this area up. It's just, again, if you don't have the underlying bone, the interproximal bone in this area, there's nothing really to gum graft. So, that's always the million dollar question. People always will ask, well, can I have a black triangle? Can you do a gum graft in this area? Just want to answer you real quick. Nope, impossible. We've tried that. Periodontists have tried that for decades. Getting gum graft from the maxillary tuberosity on the palate, using fillers. They've tried so many different things, techniques to try to get gum grafts that are going to work in that area, but it's just very unpredictable. It's not usually, not going to be successful. You have to have the underlying bone. Again, going back to the example of the tent pole. If the tent pole is not there, which is the equivalent of the bone, then how is the fabric going to be supported? How is the gum going to be supported in that case? So therefore, you're going to have a black triangle. So additional gum grafting, which was what was being recommended by her periodontist, was not going to do anything to help address that issue. So what can we do to help this patient? Well, the thing that I told her was like, she has pretty ovoid shaped teeth here. This is a more natural shaped tooth here, but I told her, listen, you most likely the simplest fix for this, because if you do additional gum grafting, which isn't even going to fix the issue anyways, it's just going to cause more scar tissue to develop in this area. And other patients will ask, well, can we add more bone graft to the area? That's not going to fix the other issue also. And plus, there's so much scar tissue up here also. So I told her the quickest, most predictable fix would be to just put 2 new crowns here. And so when they recrown this tooth, because this is a temporary crown, I recommended that they crown this tooth also so that they can get a matching set, so that they can bring the contact point up to this area so they could eliminate this black triangle. So what the heck am I talking about? Let me give a quick little example. I did a quick little Google search real quick about making crowns to get rid of a black triangle, and you could see that, again, these are black triangles. You could see those areas that occur between the gums. And so there's different techniques that you can use. For example, this is BioClear, but you can use different techniques to basically bring the contact point further up so that you can basically get rid of that black triangle. So in a case like this, the patient has very, interesting shaped teeth here. They're more like triangles, right? And so because of the shape of the tooth, if you can alter the shape of the tooth and bring that contact point where the 2 crowns meet higher up, then you can basically get rid of the whole black triangle. And so this is a quick, simple fix that a lot of dentists will use to basically get rid of the black triangles. So that was my recommendation to obviously fix the issue in this case. So again, just when she makes 2 crowns, you can get rid of this whole area and they will contact a little higher up here. Now, what ends up happening is they end up being a little bit more squarish teeth, but there's still, you could still make them look very natural and more aesthetic. Again, you're starting to see the root in this area, and I just feel that more alterations and more surgeries is just going to further exacerbate the issue. So I wanted to, again, for a case like this, it was a simple fix. Now, I, not to criticize the periodontist in regards who was working on this case, but knowing the history on this tooth, with it being a root canal where there's most likely a lot of destruction to the bone, I probably would have gone down another path. What I probably would have done is, when taking out that tooth and cleaning out the infection, all the granulation tissue that is all diseased from the root canal that went bad, I would have done essentially a guided bone regeneration at that time. And what guided bone regeneration is it's a more extensive, larger bone graft. I would highly recommend that you guys watch, again, my Dental Implant 101 series. Again, I'll link above, and also the information for the video below. But I have like this 38-minute video that talks about everything about bone grafting. And I really think it's really important that you guys understand these before you have these procedures to avoid outcomes like this. But I would have done a guided bone regeneration, waited a significant period of time, because when these root canals are done, they end up being highly toxic. I've seen that they can even cause implant failures in the future. So again, I would have done an extensive guided bone regeneration, waited probably about 6 months, taken a CBCT at that time to determine how much bone we have, and then also do more bone grafting at that time of implant placement if it's necessary. Now, I think gum grafting is also great. I think it could have been done later on at the time of implant placement, and also maybe later on when you're doing the uncovery. But I think gum grafting is a great asset and is definitely needed in some cases. But if you really want to determine the future prognosis and the aesthetics of the implant, I think that is more reliant on bone grafting. Now, I know that this is, there's going to be a lot of opinions on this, but in my years of practice, and also I am also a junkie in regards to just looking at the continuing education, going to all these seminars and watching some of the best surgeons in the world and how they get predictable anterior aesthetics for their dental implants. I think obviously hard tissue augmentation, which is bone grafting, and soft tissue augmentation, which is gum grafting, are both essential. I just rely more on extensive bone grafting and then any accessory gum grafting that may be needed in the future, maybe at the time of uncovery or when you're doing provisionalization of that implant. That's when that would be necessary. So let me give you guys, what the hell am I talking about? Let me give you guys a quick little example of a case that I had come to my office a few years ago with a bad root canal on her front tooth. So that again was a very hairy situation. I'll show you her 3D scans and also how we addressed her issues. All right, so here's a patient that was referred to me for this front tooth, and she was having an infection around the area. She finally became symptomatic. Let me show you her 3D scan. So this is, again, looking at it from profile. All this black area is just basically infected bone. You see a lot of bone destruction in this area. Now you have very little bone on this outer edge. And so I look at its case and I'm like, oh my, this is not good, especially for a front tooth implant. If we want to have any sort of predictability here, then we're going to have to remove this tooth, obviously. But the problem is that there's going to be a lot of destruction in this outer area. So I told her that she needed to do that guided bone regeneration. We had to do an extensive bone graft. So here we go. You could see the titanium mesh membrane. We did a guided bone regeneration on this patient, and you could see the little tacking screw in that area. So this is a 3D scan. You could see, again, the titanium mesh membrane with a little tacking screw, so you could see how much bone we had before, and now this is all new regenerated bone. And you could tell, right, the bone has a different consistency than the surrounding bone. Now let's look at the implant. And here's the implant 2 years later. This is back in November of 2022. The amount of bone that we have surrounding this dental implant, and exactly how big is this implant, the diameter implant. So about a 4.5 diameter implant that we use for this patient, so it's nice and stable, and we have plenty of what we call that buccal bone. Again, if you watched my videos earlier, this buccal bone is one of the predeterminers of success for to make sure that this patient has a good long-term outcome prognosis, aesthetically and also for the health of this implant. So the only way that I was able to achieve this is by doing bone augmentation procedures, and we never even did a gum graft for this patient. And so let's actually look at the photos of her. So these are photos that were taken before we placed the implant, but after the bone graft, and this is from a few years ago. This is what she looked like when she was smiling, when she was missing that tooth. And this is the tooth with the crown. This patient, again, was referred to me from a dentist in Frisco, so the dentist is the one who put that crown in. And so the patient was really satisfied with the aesthetics, and again, looking at that CBCT, that 3D scan I just showed you, it looks like that patient's going to have a good long-term prognosis from this tooth. So just to kind of wrap it up, I really think that in cases like this where patients have some sort of bone destruction or just not enough bone, I really think that guided bone regeneration can be used to really save the day. Extensive bone grafting. The catch is a lot of people ask me, well, can you really do a lot of bone grafting after the implant's placed? And no, the bone grafting has to be either done before the dental implant is placed or even added more at the time of the actual implant placement. The only typical predictable, adjusting that we can do in the future is with additional like gum grafting. But at a certain point, when you just keep on going in for repeated surgeries, you're just going to accumulate more scar tissue and therefore affect the outcome of the predictability of the case. So I really hope that this video was helpful for you guys. If you did, please give me a thumbs up, follow the channel, and also please feel free to comment below if you have any questions. I just really feel that if patients are more educated, they can help avoid outcomes like this. But kind of to go back to the point of this case, how we could fix it. At this point, the most predictable thing would be to go ahead and do some, new crowns and bring the count point, the contact point higher. And I think that this patient can have a really good predictable outcome after that. And so the patient did express interest in coming to see us for that. So we'll see. We'll follow up with her, and if we do, we'll follow up with this case and show you guys the result. Anyways, we look to see you guys again in the future. All right, thank you.